is the area we're looking at, okay? And you'll notice that there's sort of all sorts of strange things going on. There are these sort of oblique muscles coming in from the side. And then there's this one muscle running from top to bottom over here. So that in contrast to, however, in contrast to the thorax, which you'll recall from the lecture on the thoracic wall, which had lots and lots of bony stuff there, right? There's a sternum here and a bunch of ribs there, and a scapula on the back, and a bunch of vertebrae in the back. The abdomen is mainly has soft walls. There are obviously vertebrae in the back, and the upper part's got the lower part of some of these ribs, but it's a pretty soft area, which for your careers is not of great importance, but for other people in healthcare it means you can push and prod and maybe find out about things about organs that are harder to touch in the thorax. So here's the overview. The abdomen has a soft wall made from several layers of muscles, and that's mostly what we're going to talk about today. There are openings in this wall inferiorly, where in males the spermatic cord passes from inside the abdominal pelvic cavity into the scrotum, and in females there's a structure called the round ligament, which has a similar pathway. The upshot of this is that actually the layers covering the spermatic cord and the testes in the male scrotum are continuous with layers of the anterior abdominal wall. The unfortunate consequence of all this is that abdominal contents can pass through the same openings in the anterior abdominal wall that the testes go through in the course of development. And when bits of abdominal contents push through holes in the anterior abdominal wall, it's referred to as hernias. So we're going to talk about the layers of the anterior abdominal wall. We're going to talk a little bit about how they happen, and we'll talk about how hernias occur and how they're sort of classified. So as I said, as you know, the thorax, which is from pretty much from here up, has it's a bony cage. Okay, so you've got these ribs here, and these costal cartilages in front, and sternum, and body of the sternum, and xiphoid, and you've got all these bones in the back, these vertebrae in the back. The abdomen, however, it has vertebrae in the back, but they're not attached to ribs. When you get down into here, which is the pelvis, this area is the pelvis, which we won't dissect in this course, you've got the blades of the bony pelvis, the iliac crest here, and a little structure down here called the anterior superior iliac spine, which some of these anterior abdominal muscles attach to. Then you've got another bone called the pubis, another bone in the back called the ischium. So these muscles that are going down the anterior, covering the anterior abdominal wall, are attaching on various bits of this bony pelvis. So for that reason, you need to know the major parts of the bony pelvis. There's a right and a left pelvic bone. They're joined together in what's known as the pubic symphysis. So like I said, there's an anterior superior iliac spine here, something called the pubic tubercle here. This area is called the pecten pubis. This area is called the pubic crest, and we'll talk about those in a minute. Lumbar vertebrae back here, which you know are different from thoracic vertebrae in that they don't have attachments for ribs. They're a little bit bigger because they're supporting more body weight. Their spines are not long and pointed downward. They're just relatively short and stubby and facing totally posteriorly. A question that we asked on the lab exam with a little marginal success. Okay, so today's dissection is basically involved in identifying the layers of the abdominal wall. Okay, tomorrow's dissection, you will open up the anterior abdominal wall and start looking at the abdominal contents, the guts. Stomachs, livers, spleens, small intestines, large intestines, and all sorts of little blood vessels and tubes and veins and stuff that are connecting these things. Oh, in addition, it turns out that tomorrow there will be pathologists visiting the class. Okay? They're doing the medical class across the way, and they're going to come over sometime in the later part of the sometime after 3, and go through anything that go through your abdominal contents and thoracic contents. So if you notice some funny things in the thorax that look like they might be pathologies, or if you noticed on the things posted on the wall that your person died of something or other. By all means, feel free to show them, gee, what's wrong with this heart? Gee, look at this lung. Is this really a lung tumor? And so forth. They'll spend a few minutes at each table. You know, they will, by that time, hopefully you'll open up the abdomen and they can sort of look through and see if they see anything they recognize. But if you find something, by all means, ask them what it is. Okay, so they'll be doing the med students for a long time, and I told them to give you guys a chance because you won't open up the abdomen until starting at 2 o'clock. So they'll be in later in the afternoon. So if you see something funny, by all means, call them over. Yeah.
Tomorrow you have dental morph from 1 to 5.
I'm sorry. My mistake. Friday.
Okay.
Yeah, I mean tomorrow. Next class. Excuse me. No, I know the dental morphs. And you also have it next Tuesday and next Thursday. Got that. Okay, so anyway, they're coming, the pathologists will be there Thursday. It may be that we'll get another person coming in Monday when you've had a little bit more time to work your way through, but I'll let you know how that sorts out. Okay, so the point is this is not just a single unit, this anterior abdominal wall. There are a series of layers which you will want to find in the course of today's dissection. So let's blow this up. Okay, the stuff on the outside you're pretty familiar with, it's skin. Okay? Deep to that is a layer of fat, obviously of varying thickness depending upon the individual, which is known as Camper's fascia. Deep to that there is another fascia, and it's more like the fascia you saw lining the inside of the thorax, right? Sort of this thin, filmy thing. Looks like a little bit of gauze or something. It's not as fat and thick as this one, and that's known as Scarpa's fascia. Deep to Scarpa's fascia are 3 layers of muscles. Okay, at least on the side wall. The most superficial one is called the external oblique muscle, and just like the external intercostal muscles, it is oriented from superiorly and laterally down. So it's just oriented like that, like putting your hands in your pocket. Okay? Deep to that is an internal oblique muscle, and again, as with the internal intercostals, it's oriented at right angles. And deep to that is a transverse abdominal muscle, which, as you might be able to guess, is oriented transversely. Okay. Now, so these are 3 distinct muscles that are arching across the side and part of the anterior abdominal wall. Deep to these guys is a little layer, here shown in black, which is known as the transversalis fascia. And again, sort of like Scarpa's fascia, it's not a big thick thing, it's fairly thin, but looks sort of like gauze. Okay, but it's very important, and we'll talk about it a little later. More fat, and then you get to something called the peritoneum, the parietal peritoneum. Gary, would you go in my office and get my peritoneum paraphernalia? Sorry, I forgot it. Okay, we'll talk more about peritoneum in the last part of the lecture. Okay, so let's start with these 3 muscular layers. In the midline, where stuff from the right side and stuff from the left side come together, it's known as the linea alba, the white line. Okay, so here's this most superficial muscle layer, the external abdominal oblique. And as you can see, its fibers are running from superiorly and laterally to inferiorly and medially. Just like you saw, for example, latissimus dorsi on the back. There's muscular fibers here, and then they give way to a tendinous structure, a very long tendon, aponeurotic tendon that follows the rest of the way. And there's another structure underneath there. So the external abdominal oblique originates way back up here from ribs 5 through 12, and you can see it actually interdigitating with the parts of serratus anterior. Okay. It inserts in different places depending upon where it is. The uppermost part thanks, inserts on this linea alba. So the right one comes into the midline here, the left one comes into the midline here. Okay. As you move lower, this part inserts on that upper part of the pelvic bone, known as the iliac crest. Inserts on the iliac crest, all the way down to here. And then there's a big insertion here on the anterior superior iliac spine. And then the aponeurotic part of this stuff comes all the way down and goes to the pubic tubercle. Okay. These muscular fibers go into here. They don't have any particular name. These lowermost fibers, where the muscular fibers come in and go to the anterior superior iliac spine, and then there's connective tissue that goes all the way down to the pubic tubercle. This lower border of this external oblique muscles aponeurosis is referred to as the inguinal ligament. And you should be able to find that in your dissection. And you'll notice down here near the bottom of the inguinal ligament there is an opening. It is not completely sealed, known as the superficial inguinal ring. Okay. The innervation of this muscle, obviously depending upon where it is from top to bottom, is the intercostal nerves T7 through T11. And then the one that's below T12, which is called the subcostal nerve. Okay. So here's a close-up of this lower part of the external abdominal oblique and its aponeurosis. So the muscular fibers up here come together, form an aponeurosis, and go to the midline, go to the midline, go to the midline, go to the midline. This lower border comes down here to the anterior superior iliac spine and is just connective tissue all the way down to this bump here on the pubis known as the pubic tubercle. But as I said, it makes an opening here called the superficial inguinal ring that the spermatic cord goes through from inside the pelvis all the way down into the scrotum. The parts of this superficial inguinal ring, which those of you that have males will have a chance to dissect out the parts, have names. So the lower part that comes down here is referred to as the lateral crus, the lateral leg of this opening. The upper part, more medial part, is referred to as the medial crus. Okay. And you obviously don't want this opening to continue all the way up your side and your anterior abdominal wall. So there's some other fibers that are tying these guys together, known as the intercrural fibers. And if you have a male cadaver and you dissect it very carefully, you should be able to find these parts of the ring. And sometimes in females, there's a round ligament that passes through the same area, and sometimes it's actually easier to find these structures in females because the males have often had some sort of hernia surgery and it's a big mess down there. Okay, so on the other side, here's just this, again, this inguinal ligament, this lower border of the external abdominal oblique. Internal abdominal oblique, as I said, it's going in the opposite direction from posteriorly and laterally inferiorly to medially and superiorly to insert on the linea alba. It originates down here, so it's going to originate from the thoracolumbar fascia in the back, right? Originating from the iliac crest. It's deep to the external oblique, and it's originating from this inguinal ligament that is forming the border along here. Arching upwards and medially to insert on the underside of the lowest three ribs. Part of it's inserting on this midline, this linea alba. Part of it does a really strange thing. It comes out like this and then changes its mind and flips back down to attach on the pecten pubis. And this part that starts out going up and then changes its mind and comes down medially and inferiorly is known as the conjoint tendon. Just like external oblique, it gets its innervation from intercostal muscles, the lower 7, 8, 9, 10, 11, and the subcostal, which is the one that's under under the 12th rib. The layer deep to that is called the transverse abdominal muscle, and as the name implies, its fibers are oriented transversely. So it originates on the back, down up here from ribs 7 through 12, then on the back from the thoracolumbar fascia where it wraps all the way around. The lower parts can come off of this iliac crest, and the lower parts still can come off of this inguinal ligament running from here to here. Again, it inserts on the midline, the linea alba. The lower parts, again, flip over and go and join on the pubic crest, known by that conjoint tendon. So fibers come across mostly to the midline, but these lower parts are slipping down and going into the pubic crest and affecting part of the pubic bone. Innervation, again, T7 through T11 in the subcostal. When you're dissecting, it'll be, if you go in and your dissector tells you sort of separate the layers. Separating external and internal is fairly easy. Separating internal and transverse abdominal can be a little bit more difficult. But if you flip it back and look in from the inside, you see the fiber directions are going in the wrong direction. You've obviously pulled off internal oblique and transverse at the same time. Okay. Now I've talked about the ones that are wrapping around the side wall of the abdomen, the 3 layers. Running vertically at the midline is a muscle known as rectus abdominis, the straight abdominal muscle, and the one, of course, that all you guys spend all your time doing sit-ups to get these 6-packs or 12-packs or 8-packs or whatever you can muster to show off at the beach. This is Long Island, after all. Okay. Rectus abdominis is an odd muscle in many ways that we'll talk about. It basically originates, okay, way down here on the pubic symphysis and the pubic crest. So this part where the right and left pubic bones come together. And it extends vertically and inserts on the xiphoid process, the lowest part of the sternum, the costal cartilages 5 through 7, all the way around here, so it's the midline. It's innervated, the same stuff, right? T7 through T12.